Hi everyone, hope you're doing well. My name is Dr. Mena Mirhom, and I'm a psychiatrist. And I was asked by our department to share some tips with you in the middle of this really hectic coronavirus time. Think a little bit about our mental health. So what we're going to focus on today is how do we cope with coronavirus? How do we cope emotionally? How do we cope mentally? What are some tips that we can keep in mind as we deal with this pandemic that's very disturbing, around the world? And what I'm going to do today is actually illustrated my first point, which my first principle or my first tip for you is practice good information hygiene, right? We talked about hygiene a lot, washing your hands, social distancing, all that kind of stuff. The other very important thing emotionally and as well as for us to cope is good information hygiene. And that's why my conversation with you today will be focused on one source, which will be from the CDC. What we mean by information hygiene is be careful of misinformation. A lot of times now on social media and in the internet in general, there's going to be things that are sensationalized, going to be things that are blown out of proportion, or just misinformation to get you to click, to get you to like, to get you to share. So beware of that. I've heard things recently as silly as, you heard an apple a day keeps a doctor away, now a banana a day keeps corona away. Okay, so there's going to be silly things like that. So that's why for us, we're going to be basing our conversation from the CDC guidelines in terms of coping with this emotional stress. The first thing that the CDC recommends here is, first, the same way that we're talking about the vulnerability physically, right? If you're older and you're over 65 and you have these health conditions that are putting you at risk physically for coronavirus, understand here too that if you are more anxious at baseline, if you already are struggling with a mental health diagnosis of any kind, this can put you at more risk for a pandemic like this. So understand that to begin with. Understand where you are currently. Take a deep breath. Acknowledge that, you know what? I know where I am, I know where I stand, and because of this, I have a vulnerability going into this already. Several people have reached out to me, friends of mine, said, you know what, Dr. Mirhom, I already have an anxiety disorder, and I've been dealing with this, and it's been really, troubling for me, and I've been having more symptoms. So if that's where you are, understand here are some things from the CDC that can be a sign of a stress during an outbreak. One of which could be increased fear and worry about your health and the health of others. So we're all in that position. But if you start noticing changing in your sleep patterns, you're not sleeping the way you were before, you're having difficulty concentrating and focusing, or there's a physical worrying or a physical rather increase in your chronic health conditions, as well as maybe you're beginning to look at different ways of coping that are not healthy, including substance use, alcohol, that sort of thing, that could begin to be a warning sign for you that you're using maybe unhealthy coping skills. And lastly, within the coping skills part, or within the warning signs, if in these warning signs you're also seeing, you know what, now I'm so concerned and I'm so worried and I'm so consumed by this that I'm having thoughts to harm myself or harm someone else, this is a red flag for you to tell you, okay, pause, hold everything, and we should be reaching out for emergent help. 911 will still be available for you, though we can take necessary precautions and make sure that you're safe. Okay? So that's one thing in terms of look for the warning signs, understand your vulnerability. Secondly, what else can we do? What are some practical coping skills that we can be aware of? Having said the vulnerability, the other thing is know that you can connect to your resources. Okay? Our resources around us are very, very important. If you're someone who is already in mental health treatment, this is not the time to discontinue. This is not the time to social distance from your therapist or social distance from your psychiatrist. Many, many options are available remotely. Make sure to talk to your healthcare provider and ask what remote options are available for me to pursue treatment with you. If you're not currently in treatment, this is a great time to be in treatment because now everyone is finding a way to get you in treatment quickly and make sure that you can do it from the safety of your own home. So I would encourage you to explore that option as well. Treatment, that's the number one thing. What else is the CDC telling us? The other thing is maybe limiting how much news exposure we get. It's understandable. We want to be up to date. We want to be on our Twitter feed. We want to know what's happening every single second. But you know what? You don't need to know every single piece of breaking news. Guess what? We're in a pandemic. There's going to be new cases every day. There's going to be new developments every hour. But maybe we don't need to be on the news 24 hours a day. Maybe we don't need to receive every single update. Change some of the notifications on your phone. Maybe having a little bit of distance from the news, a little bit of distance from the stories, social media, and the highlights can be really, really important. That's one thing CDC recommends. 2, taking care of your body. in a very literal sense, this can be making sure that you're sleeping. Make sure that you have the time to take a deep breath, like I'm not doing in this video. I'm trying to get you as much as I can in a short time. Okay? Meditate. Eat healthy. This is a time where, you know what, because we're stockpiling toilet paper, I don't know if anybody's buying food anymore, right? But they're still important to be able to eat a healthy amount of food and lean on the healthy habits that you developed in the past. Drinking plenty of water, maybe even being able to exercise. Friends and family. So an important thing here as well is that these supports that we have around us in terms of social connection, just because we're socially distancing does not mean social isolation. We still need to be in connection with one another. Sometimes for some people that includes your faith tradition. It's a very important place as well to be getting that support. The other thing is making sure that you have time built into this quarantine and this kind of social distancing to just unwind and to be able to take a load off and to take a moment to put all of this in perspective. Okay? These are some of the things that the CDC is suggesting for us. That's for those of us who are on the front lines. And they also emphasize the fact that if you're a responder, you want to be paying attention to these physical signs as well as these emotional signs. This fear, guilt, withdrawal, anticipation. Those are things that are all part of what they would call a secondary trauma stress reaction. Okay, this is very, very important for us to keep in mind. And then when we're talking about how do we discuss this with our children or with those around us, the big message that is from the CDC guidelines that I'm going to share with you as well to make sure you have the text is begin with facts over fear. Same way that we're beginning with good emotional hygiene, we want to share that same approach with our children, our loved ones, that we stick with facts and reassurance. Ultimately, we're going to get through this. Ultimately, we're going to be safe. That's the kind of tone that we want to maintain, we want to keep. So we want to be cautious, but we want to be realistic, and we want to be optimistic as well. And you want to be a role model. You want to model this behavior for others. This applies both for how we're dealing with family members, children, and so on, as well as for one another. We want to model the idea that this is a time, we're in a crisis, it's the feeling of being almost at war. We want to model altruism, kindness, being there for one another, and not every man for himself, because believe me, the way this pandemic is looking, it's not an every man for himself kind of deal. We will need to be there for one another to be able to all be safe. Okay? So those are some of the big things that we want to share with you today from a psychiatry perspective. Make sure that you're taking care of your emotional health as well as your physical health, because they're definitely related. And make sure that you're watching for those warning signs. Make sure you're on the lookout for, am I experiencing more of these physical or emotional warning signs? And is this a good time for me to reconnect or to connect for the first time to care? Until then, remember, we're going to get through this together. We're going to make sure that we're kind and altruistic and connected. And then we'll be able to get through this. All right? I wish you all the best. Again, Dr. Mirhom signing out. Thank you so much.